Good morning to all of you. So today we are going to study about genetic disorders. Okay, this I will be taking in 3-4 classes. Okay, so today we are going to start the first class. The topic is patterns of genetic disorder. Okay, now most of you have attended a few classes of genetics along with BSc Nursing second year. So you keep that in mind, because I have not taken all those aspects, because that has already been taken. What is a gene, what is a chromosome, what is DNA, what are the parts of DNA, all these things we have already completed. Okay, now we are going to study, your syllabus is introduction to this specific patterns of genetic disorders. So we are now directly coming to the topic. So what is genetics? Genetics is a study of genes, genetic variation and heredity in living organisms. Okay, so in genetics we deal three things. We study the genes also. Second is we study the genetic variation. If some gene is having any changes or mutations, so we study that. Third is we also study heredity. Heredity means if a parent is having some abnormal gene, to what extent it is transmitted to the next disorder, is it transmitted, is it not transmitted, all these things. Okay, so these are the three aspects which we basically study. We study the genes, we also study if some variations are there. Third is we also study the heredity. Okay, now this will come to they will continue with introduction. We have already studied this aspect. Genetic is the study of pattern of inheritance. Pattern means to what extent are the chromosomes transmitted from one generation to the other. What is the meaning of all this? We will come to the subsequent slides, and then we'll come to know. So normally in every cell there are 46 chromosomes, and out of 46 chromosomes, during meiotic division, during reproduction, most of the fetuses, they receive 23 chromosomes from each parent. Okay, so that way 23 plus 23 becomes 46. Okay, so one zygote will have 46 chromosomes, 23 from the father and 23 from the mother. Now chromosomes are structures which are found in every cell of the body. Okay, and there are 22 sex chromosomes which are called as autosomes, and there is one sex chromosome. Okay, so out of this 23, 22 are autosomes, and these autosomes are non-sex chromosomes, and we have one sex chromosome, one sex chromosome pair, so that is 22 plus 1. Okay, now we'll come to the next slide. In males, most common sex chromosomes is XY, and in females it is XX. Okay, so on each chromosomes are hundreds of gene pairs. Okay, in each of the chromosomes hundreds of gene pairs are there. And what are genes? Genes are blueprint for the human growth and development, and tell the cell how to function. Okay, so our blueprint, how the growth and development has to take place, all this will depend on whatever genes we have. Okay, so you now must have understood the chromosomes, they contain many genes. Okay, and genes are in pairs, and genes are blueprint for the human growth and development, and it also specifies how the cell has to function. Okay, now this human body has 20,000 different genes in each cell. Okay, it's not one or two, it is about 20,000. Okay, genes are located on the chromosomes, which are stick-like structures in the middle of the cells. Okay, so if you see this, these are stick-like chromosomes which are present in the cell, and this is present in the nucleus. Okay, so each cell has 46 chromosomes which are bred in 23 genes, which we have already studied, and each gene has a specific function. Okay, so what is the function of gene, what are the different types of gene, all these things we have already discussed along with second years. Okay, so when a gene or a chromosome is abnormal, it may cause health problem. Our issue in pediatric is, as long as it is normal, no issue. Okay, our issue is when it is abnormal. Now when it is abnormal gene, it causes some diseases in the children. Okay, now this classification of genetic disorders. And genetic disorders due to traditional mode of inheritance are called as Mendelian disorders. Okay, we shall be studying we have other disorders also. So this is the most common one, traditional mode of inheritance. They are called as Mendelian disorders. Mendelian disorders are also called as single gene disorders. Okay, so they are autosomal dominant, which is called as AD, autosomal recessive, which is called as AR. Then we have X-linked recessive and X-linked dominant. So that is XLD and XLR. Okay, so we shall be studying about details of all these things. Okay, now is causes of genetic disorders. Okay, 60% of birth defects do not have any known cause. That is the biggest problem. Many of the husband and wife will be perfectly normal, but they have a child of Down syndrome or maybe phenylketonuria or any other problem. So that is the issue. 60% do not have any known cause. Okay, chromosomal defects only 6%. Okay, then there are some multifactorial. What is multifactorial? That is some genetic issue is there plus environmental. Okay, so these are environmental means maybe some exposure to chemicals, maybe some drugs. Okay, so these are the environmental factors. Okay, so if it is a combination of genes and environmental, it is called as multifactorial. Okay, so this multifactorial accounts for 20%. Okay, apart from that we have teratogens. Okay, teratogens are agents that are known to cause birth defects. Okay, so these can be medications, can be illegal or maybe legal, or maybe in the environment, or maybe metal infections. Okay, so these are all teratogens. What are teratogens? Teratogens are those agents which cause birth defects, and these teratogens can be some drugs, maybe legal drugs, maybe illegal drugs, or maybe environmental pollution. Okay, which is causing, or maybe a metal infection. Okay, environment, I would like to you must have heard about Nagasaki and Hiroshima. You must have heard about Bhopal gas tragedy. Whenever you have such environmental factors, the fetus which are born children who are born after the exposure, we find multiple abnormalities in children. So they are called as teratogens. Okay, or it can be even a metal infections. Next is teratogen cause about 4 to 5%. Okay, so these are the defects. 60% we don't have any cause. 6% chromosomal disorders. Multifactorial is 20%. Teratogens may be causing only 4 to 5% of the birth defects. Okay, now we shall be studying about chromosomal disorders. Okay, a chromosomal disorder may be inherited or may be sporadic. Sporadic means husband and or father and mother are not having any history, but a child has. That is called as sporadic. Okay, that is, there is no family history, but still the child has a chromosomal disorder. Now we have some common chromosomal disorder. First is aneuploidy. Okay, aneuploidy means a wrong number of chromosomes. Either they are less or they are more. We have studied the normal number. Normal number is we have we have 23 pairs or 46 chromosomes. Okay, so these are the examples of extra chromosome, trisomy. Trisomy means 3 instead of 2. It is 3. Okay, trisomy 13, 18 and 21 are examples of extra chromosomes. For example, trisomy 21 means instead of a usual pair of 2, it is 3. Okay, that is called as trisomy. Okay, next is Turner syndrome is another example where less number of chromosomes is there. So instead of 46, it is 45. Okay, so one of the chromosomes is not transferred, leaving a single X chromosome. So instead of double X, it is single X. Okay, so I think aneuploidy is clear. Aneuploidy means wrong number. Either the chromosomes are more or it is less. More trisomies are all examples of more number of chromosomes. Trisomy 13, 18 and 21 are examples of more number of chromosomes, that is extra chromosome. And this number, if it is trisomy 13 means 13th chromosome will be having third pair. Okay, 3 numbers. So similarly 18 and 21. And Turner syndrome is few. Instead of 46, it is 45. Okay. Now, next example is of chromosomal disorder is deletion. Deletion means a part. Deletion means we know something is cut off. Okay, that means a part of chromosome is missing, which ultimately means that genetic material is missing. Okay, clear है? Chromosome में genes है. If some part is of chromosome is missing, means some genes are missing. Okay, so which ultimately means the genetic material on the missing section of chromosome is missing. So example is Cre-du-Chat syndrome. Okay, where a portion of chromosome 5 is missing. Okay, Cre-du-Chat syndrome where a portion of chromosome 5 is missing. So this is an example of deletion. Deletion means something is cut off. Okay, something means here it is a part of chromosome. Next is inversion. Okay, inversion means upside down. Okay, refers to a chromosome that is broken and the broken piece turns upside down and reattaches itself. Okay, is it clear? A part of chromosome cuts off, gets inverted and reattaches itself. So this type of defect is called as inversion. So inversion may cause or may not cause the birth defects. Okay, next is translocation. What do you mean by translocation? When a chromosome segment rearranges from one location to the other, that is from one location it is going somewhere else. Okay, so this may come back to the same chromosome or it may move to another chromosome. So there are two types. One is balanced and second is Robertsonian. Okay, balanced translocation is where the DNA is equally exchanged between the chromosomes. Okay, equally exchange means, for example, 1 and 2, if a small part goes from chromosome 1 bulb, it will attach to chromosome 2 and same part will come and attach to chromosome 1. So that is why no DNA is lost or added. Okay, so a parent with balanced translocation is healthy, but he or she may be at risk for passing unbalanced chromosome to the child. Okay, what is balanced chromosomes? The one thing to understand is we know the shape of chromosomes. Okay, so chromosomes, if one part is missing from not missing, translocated means a part of chromosome will detach and it will attach to maybe this same chromosome or maybe another chromosome. Okay, so if it is going to another chromosome, that same part will come and attach to the first one. So that is called as balanced translocation. Okay, so what is Robertsonian? This is also a balanced translocation where in which one chromosome joins the ends of the other. Okay, so one chromosome will go and join to the end of the other. So this is called as Robertsonian translocation. Okay, next is Mosaicism. Mosaicism means here in some cells there will be 45 chromosomes, in some cells there may be 46, in some cells there may be 47. Okay, so in same person, if you examine different cell, some cell will have the normal number, some cell may be having either more or maybe less. Okay, that is an example of 46 and 45 or maybe 46 and 47. Okay, either may be less or maybe more in the same person in different cells. So that is called as mosaicism. These are the different types of chromosomal disorder. Okay, so we have discussed different chromosomal disorder like translocation, mosaicism, deletion, inversion and aneuploidy. Okay, so this is what we have already discussed. Okay, now these are examples of chromosomal abnormalities: Down syndrome, Turner syndrome, Klinefelter syndromes and Cre-du-Chat syndrome. Okay, now this will come to next type of chromosomal disorders, which are called as single gene disorder. Okay, single gene, these are the traditional disorders. Okay, so when a certain gene is known to cause a disease, it is called as a single gene disorder or Mendelian disorder. Okay, so when a single gene is known to cause a disorder, okay, so that they are called as single gene disorder. Okay, so disorder caused by a defect in a single gene follow the pattern of inheritance described by Mendel. Okay, Mendel has done great works in studying the inheritance patterns. Okay, according to what has been described by Mendel, so this is how the patterns of inheritance are continued. Okay, So risks within an affected family is usually high and are calculated by knowing the pattern of inheritance and details of the family pedigree. Okay, pedigrees are formed to find out. In the next class I will show you a picture of pedigree. Okay, pedigree is just to find out to what extent which child is affected. We have a diagrammatic representation of that. Okay, so if some chromosomal disorders are there in high risk families, we find out what is the chances of inheritance. Okay, in some disorders there are 50% chance, in some disorder there are 25% chance, etc., etc. Okay, so based on Mendelian pattern we shall be studying. Okay, now in single gene disorder, first is autosomal dominant disorder. Okay, so single gene disorders are basically divided into two groups. One is autosomal, second is X-linked. Okay, autosomal is, we know that they are not sex linked, and X-linked are related to the sex chromosomes. So both, whether it is autosomal or whether it is X-linked, both are divided into two. One is dominant and second is recessive. Okay, we shall start with autosomal dominant disorder. Okay, so autosomal dominant disorder may be inherited from one parent who is affected. Okay, one partner is normal, one parent is affected. So even if one parent is affected, the disease can occur. Okay, dominant means the non-functional gene of a gene pair is able to override the normal gene. Okay, so in dominant what happens is the non-functional gene of the gene pair is able to override the normal gene. Okay, so the non-functional gene will be able to override the normal gene. Okay, even if only one parent is affected. Okay, so a person affected by autosomal trait has a 50% chance of passing it to his or her offspring. Okay, so in each pregnancy there is 50% chance of passing it to the next offspring if it is a autosomal dominant disorder. Okay, now this is affected father, this is unaffected mother. Okay, so this is a normal gene and this is mutated gene. Okay, so blue is mutated gene. Okay, so what we find here is, see how to find it out. See, one and this. Okay, one blue and one this. Okay, so this is a affected child. Okay, second is this one and this one, so not affected. Third is now this one and this one, so not affected. Okay, last is this one and this one, blue. Okay, so whenever you have affected gene, it is affected child. So how do we count? If you see this, 50%, out of 4 children, 2 children are affected and 2 children are not affected. In that way we tell that there are 50% chance of transmitting the mutated gene from one generation to the other. Okay, is it clear? And how do we do it? See, we take this one. Okay, here because it is affected child, you take blue and 1. Okay, second is you take this one and this one, then again you take this one and this one. Okay, so whenever you have this combination with either this or this, children will be normal. When it is combined with one normal and one affected, and we have already studied that even if one parent is having that non-functional gene will be able to override the functional gene. Okay, so there are, because out of 4 children, 2 children there are chances of being affected, so there is 50% chance. Okay, now we'll study autosomal recessive disorder. So this will most commonly occur when both parents are carrying the trait. Okay, and the offspring receives non-functional gene from each parent. Okay, so recessive diseases will only occur if both parents are having a disease. Okay, so recessive means that traits of non-functional gene are hidden by the normal gene or the normal gene overrides the non-functional gene. In the previous one, dominant, we studied the non-functional gene was overriding the normal gene, but here is normal gene is overriding the non-functional gene. Okay, so the person may carry the non-functional gene but may not have any symptoms. Okay, see, this is a autosomal recessive disorders are only possible to transmit if both the parents are having. See, dad is a carrier, mom is a carrier. Okay, so what happens is, carrier means those conditions where they don't have symptoms but their gene is able to transmit the disease, so that is called as carrier. Okay, see, this is a working gene and X is non-working gene. See, this this tick mark and this tick, the child doesn't have a disease and is not a carrier. Okay, because X is a carrier. Okay, so this is normal. Now here it is one tick mark. Okay, this one X and one tick mark, so they don't have a disease but are carriers. Okay, same thing here, this tick mark and this. Okay, so again children don't have the condition but are carriers. Okay, next is, this child has a condition. Why? Because from both sides the gene is there, defective gene is coming, so this child is having disease. So what do we confer from this chart? That 75% of the children do not have a condition. This child doesn't have, this child doesn't have, this child doesn't have. Okay, these two children are carriers but they don't have the symptoms. This child doesn't have symptoms. So based on these three children are not having symptoms, but one child has a disease. So with each pregnancy there are 25% chance of transmitting the disorder, provided both the parents are having. Okay, provided both the parents are having, then there are 25% chance and 75% chance of not having. Okay, so there is 25% chance of inheriting the disorder, 50% of chance of being a carrier, and 25% chance of not having a disorder. Okay, so this is autosomal recessive disorder, where disorders will be there only if both are carriers, otherwise the risk is very less. Okay, now this X-linked dominant. Okay, so in X-linked it is through the sex chromosomes. Okay, so affected fathers will transmit the disorder only to their daughters. In X-linked, okay, see, it is related to X, not Y. Okay, so that is why affected fathers will transmit the disorder only to their daughters. Okay, and affected mothers will have 50% chance of transmitting the disorder to her offspring. Okay, if the father is there, if the father is affected, then daughters will be affected. Okay, sons will not be affected. Okay, because Y will be going from the father, and but in daughters X will be there, so affected fathers will transmit the disorder only to the mothers. But if it is a mother, then there is 50% chance of transmitting the disorder to her offspring. Okay, now this is unaffected father and affected mother. Okay, X-linked. X-linked we have in dominant we have already studied that if one parent is having, the disease can occur. Okay, so here what we find is unaffected son, affected daughter, okay, so that is why there is 50% chance of if the mother is affected, there is 50% chance of transmitting the disorder. Okay, is it clear? If the mother is affected, there is 50% chance of transmitting the disorder. Okay, but if the father is affected, he will be transmitting only to the daughters, not to the son. Okay, because it is X-linked. Next is X-linked recessive disorders will typically affect the male because it is X-linked. Okay, will affect typically the males. A non-affected female is a carrier who will pass on the disorder to 50% of her sons, and 50% daughters will be carrier. Okay, so X-linked recessive occurs only to male but not to females. Okay, so with an affected male, all his daughters will be carriers. Okay, so this is X-linked recessive inheritance. Carrier mother. Okay, mother is carrier and this is father. Okay, so what you have is this X and this X, 25% normal daughter. Okay, this Y and this X, normal son, 25% chance. Then there is a carrier daughter. Okay, carrier daughter, this X and this one, so it is a carrier daughter. Okay, then is affected son. Affected son is this X coming here and this Y. Okay, so in X-linked recessive disorder, only the sons are affected. Okay, only the sons are affected and daughters are carrier, and 50% chance that normal children will be there. Okay, normal children will be there. Okay, these are example of single gene disorder: cystic fibrosis, alpha and beta thalassemia, sickle cell, Marfan's, fragile X syndrome, Huntington's, and chromatosis. Now next disorder is multifactorial genetic inheritance disorders. Okay, so multifactorial we have already discussed earlier also, where you have a combination of factors. That is, first is environmental factors, may be due to chemicals, and there is mutations in multiple genes. So when these two things combine together, so this causes a multifactorial. Multi is more than one and factors is more factors. And what are those factors? It is a combination of genetic factors as well as all mutations in multiple genes, and a combination of environmental factors. Okay, environmental factors as discussed earlier, maybe some drugs, maybe some chemicals, maybe environmental pollution, etc. Okay, so there are some different genes that influence the breast cancer susceptibility, and these are found in chromosome 6, 11, 13, 14, 15, 17 and 22. So these are examples of genetic disorders. So if any person is having breast cancer susceptibility in any of these chromosomes, and if such a person is exposed to environmental factor, so the chances of occurring in genetic disorders is more. Okay, so these are the examples of multifactorial inheritance: heart disease, hypertension, Alzheimer's, arthritis, diabetes, cancer, and obesity. Okay, so these are example of multifactorial inheritance. Now is mitochondrial genetic inheritance disorder. Okay, so mitochondrial genetic inheritance means this type of genetic disorder is caused by mutations in non-nuclear DNA of mitochondria. Okay, if you remember the cell, we know that DNA is present in the nucleus, but this is non-nuclear DNA. This is non-nuclear. Non-nuclear means that DNA which is not inside the nucleus, but where it is present in the mitochondria. Okay, so every mitochondria may contain 5 to 10 circular pieces of DNA, and egg cells, not the sperm cells, they keep their mitochondria during fertilizations. Okay, we know that a combination of egg and sperm, they become a zygote. Okay, so egg cells, they keep their mitochondria during fertilization, but not the sperm cell. So if it is a mitochondrial DNA, it is always inherited from a female parent, not the male parent. Okay, this is clear theory. During fertilization, what happens is we have one egg and one sperm. So these egg cells, they contain mitochondria. They retain the mitochondria. Okay, so if there is any mutations in that DNA which is non-nuclear, non-nuclear means those DNA which is present in mitochondria, it is not inside the nucleus. Okay, so if these DNA are having some mutations, so they may cause some disorders. And what are those disorders? These are the names. Okay, first is LHON, that is Leber's hereditary optic atrophy. Okay, these are all rare disorders. Okay, and eye disease. Then we have MERRF, myoclonic epilepsy with ragged red fibers. Then we have MELAS, that is mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. It is a rare form of dementia. Okay, so these are all rare disorders, but these disorders are caused. Why? Because the DNA which is present in mitochondria of the female egg, if they have some mutations, then the fetus will have all these problems. May have one or more of these problems. Okay. Now is how to diagnose genetic disorders. Okay. So first is, so if you have suspected disease, then we have some screening tests. Okay. So we know that pregnancy is divided into 3 trimesters. So first trimester screening is to identify those who are at risk of having a baby with Down syndrome or trisomy 18. But what we do is, we are interested to know Down syndrome is trisomy 21. Okay, if you are interested to know whether the child is having Down syndrome or maybe trisomy 18, what we need to do is, we have an ultrasound measurement which is called as nuchal translucency. Okay, this test is called as nuchal translucency. Nuchal means neck. Okay, so what we do is, during ultrasound we check the measurement of the fluid accumulated behind the baby's neck. Normal is 2.18 millimeter. Okay, if it is thick, then it is either it is Down syndrome or it is trisomy 18 or it indicates some heart problem. Is it clear? So what we do is, the ultrasonography, what they do is, during ultrasound they check the neck, that is fluid collection in the neck, not in behind the neck. Okay, so if it is more than 2.18 millimeter, then this indicates Down syndrome or maybe trisomy 18 or heart problems. Okay, next is, first trimester screening is typically done after 11 and before 14. After 11 and before 14 weeks of gestation, this is what we do. We get the result in a week. Okay, so if it is a positive screen, that means the calculated risk of having a baby with Down syndrome is greater than or equal to a 35-year-old woman's risk. We know that Down syndrome, the risk of Down syndrome keeps on increasing as the age of mother advances. Okay, so if it is a positive screen, that means the chances of having a baby with Down syndrome are either it is greater or it is equal to women who is conceiving at the age of 35 years. Okay. Now this second test is called as triple screen or AFP3 test. Okay, so it is a blood test to screen for those who are at increased risk for baby with genetic disorder, especially Down syndrome and trisomy 18 or maybe a neural tube defect. Okay, so if we are interested to know whether the child is a child going to have Down syndrome or is it trisomy 18 or is it a neural tube defect, then we need to do this test, that is triple skin or AFP3 test. Okay, so this is done after 15 but before 21 weeks of gestation, and we screen 3 chemicals which are from a pregnant woman's blood, that is alpha fetoprotein, human chorionic gonadotrophin, that is HCG, and estriol. Okay, so these 3 things are tested, so that is why it is called as 3. Okay, so we check for Down syndrome, trisomy 18, neural tube defect. Okay, it is done after 15 weeks but before 21. And what are the chemicals we check? Alpha fetoprotein, HCG, that is human chorionic gonadotrophin, and third is estriol. Okay, now is another test, third test is called as CVS, that is chorionic villus sampling. It is an invasive test which is done between 10 to 12 weeks of gestation. Okay, so what are chorionic villi? Chorionic villi are microscopic finger-like projections which makes up the placenta. Okay, placenta is full of chorionic villi. Okay, so the cells from the placenta can give us information about the baby's genes. Why? Because it is from the same egg, fertilized egg, the baby and the placenta are formed. So what you do is, we take a sample from the chorionic villi and then you check. Okay, which makes, and these are present in the placenta. Okay, so what we do is, we have an ultrasonography, either it is through cervical or a vaginal route. Then we use a needle, and based on a ultrasonographic guide through the vagina or through the cervix, we take a sample of chorionic villus sampling. Is the thing clear? Where is chorionic villi present? It is present in the placenta. And how are we going to get an idea about the fetus? By taking cells of the placenta. Why? Because it is from the same cell. Placenta and fetus both are formed from the same cell. Okay, so that is why you take a sample of the fetus of the chorionic villi, and by studying the chromosomal number we can identify the problems in fetus. But this cannot be done only by a needle, but we need the guide of either a vaginal or a cervical ultrasound. Okay, so this is this. See, this is the transducer, and we have a ultrasound. Based on the ultrasound guide, the needle is inserted. Okay, and then you take a sample from the placenta. Next is amniocentesis. This is done at 16 to 18 weeks. So what we do is we insert a needle at the abdominal wall, and we take some sample of the amniotic fluid. Okay, and it takes 2 weeks, but we have quick tests which are called as FISH. I will be telling about this test in the next slide and next topic. Okay, what is FISH? It is fluorescence in situ hybridization. Okay, what it is? Fluorescence in situ hybridization. Okay, so by doing this test we get the result in 1 to 2 days as compared to 10 to 14 days. Okay, so this is how you do a amniocentesis. You have ultrasound transducer, we introduce a needle, and then we take some amniotic fluid, and then we study. Okay, so that is called as amniocentesis. Now apart from that we have ultrasound. Okay, so ultrasound is a non-invasive test performed almost routinely. Every pregnant woman has to undergo the ultrasound. Okay, so ultrasound will give us any physical defects. There are many chromosomal disorders which have some physical defects. So by seeing those things we identify. Okay, so what do? Ultrasound gives us an idea of the position of the baby, the amount of the amniotic fluid, what is the position and structure of placenta, what is the position of the cord, what is the length of cervix, all these things. And okay, then can provide more specialized view on the blood flow and velocity within the heart and the umbilical cord. All these things can be found out by a simple ultrasound. Okay, so ultrasound may not be able to directly pinpoint the genetic disorder, but will be able to provide us with information about anatomical disorder. Okay, so this is how ultrasound is done. This is the transducer, this is a pregnant lady, and this is how the ultrasound is done. Okay, now apart from that we have non-invasive prenatal screening. So what we do is we take a blood sample from the mother, and then we check whether the mother is having any chromosomal disorders like aneuploidy. Aneuploidy, as you remember, it is either less or more number of chromosomes. Okay, so we do that. Next is carrier testing. Carrier testing is done on both the parents, and we are interested to know whether the parents are having any genetic disorder. So for that we do a test which is called as carrier screening. Okay, now these are a table of genetic disorder. Okay, so this includes what is the name of the disease, what is the defective gene, and how it is inherited. That is it autosomal dominant or it is autosomal recessive? All these things are given, and apart from that clinical features are also given. Okay, so these are a table of genetic disorder. Okay, so you can go through these slides and so that was all about the different genetic disorders. Okay, we have some areas left like what are the, how do you test different genetic tests, that will be the next topic. Then we shall also be studying about what is genetic counseling, what is the role of nurse in genetic counseling. We shall be studying that. Okay. Then we also shall be studying about genetic tests. Okay. So that all will be discussed in the next slide, along with legal and ethical issues. Thank you for a patient listening. If you have any doubt, please ask.